Here I would like to acknowledge, not only am I joining from the lands of the Kusapsan and Lekwungen families and ancestors, this is also where Royal Roads University is located. And we know that many of you are joining from all different places. This is the beauty of Zoom. We can zoom in from many different parts of the world. But I would like to acknowledge my gratitude for the lands where Royal Roads University rests. And this is historically a gathering place. And so we acknowledge that this is where the past, the present, and future of Indigenous and non-Indigenous students, faculty, and staff, and guests all come together to learn and enrich one another through a circle and through a learning experience such as this one today. And I'll say Haishka Siyam. Thanks, Selena. On to the next slide. I'd also like to acknowledge that this webinar series, the whole series, there's a series of 3 here for which Harmony is the first speaker. This has been funded by the Exploring New Ways grant, and that's a fund that comes through the Ministry of Advanced Education, Skills and Training, and it's administered through our Office of Indigenous Education. So I'd like to raise my hands and say thank you to Russ Johnson for his work administering this fund, and also raise my hands to our research office because we also have some complementary funding from BC Ministry of Health through an institutional grant as well. And of course, a huge thank you to the whole Indigenous leadership team at Royal Roads, as well as the Heron People Circle of Old Ones and Elders who guide all of the work that happens toward goals of decolonization and supporting new ways of learning, being, doing, knowing, and new perspectives at Royal Roads University. On to the next slide, please, Selena. So here we are, we're giving you a brief introduction to what we're doing here today and why we've gathered here today. The format is essentially like this. I'll say these few words of introduction, and then Harmony will be introduced by the program head of the Masters of Arts in Leadership program, Dr. Cheryl Haycoop. And then of course, Harmony will share her talk, the main attraction here. We'll move on to some questions in the chat and a little bit of dialogue following Harmony's talk. And toward the end, we'll give you a few options for how you can stay connected with us, learn more about what we're offering, future webinars, and so on. So we invite you to stay through to the end, or if you're not able to join everything live, you'll also have the video sent to you afterwards by email with the email you used to sign up for the session, and you will be able to watch the remaining of the time if you're not able to stay for the whole session today. Now, I would like to offer that sometimes when we come together in a large group like this, we've had such an amazing turnout, but even a small group, there are some guidelines and values that can help to remind us how to be together in a good way in community. And often the values that I've learned from many, many teachers, and most recently through my colleague Harley Eagle, the values I would like to name and put into our circle as we're beginning here today are humility, respect, integrity, generosity, courage, empathy, and fortitude. And I would invite us to bring these teachings in and really remember them as we listen with open hearts and open ears to Harmony's words, and especially toward the end as we get into the question period as well. We will be summarizing the questions and reporting them back to Harmony so that she can reply to them in a bundle toward the end. So thank you, Selena. On to the next slide, and here I'll introduce Dr. Cheryl Haycoop, the program head for the Masters of Arts in Leadership, and this is the program that is sponsoring and hosting this webinar. So over to you, Cheryl. Thank you.
Hello, everyone. Wonderful to be here with you today. I'm joining today from the traditional lands of the Salish people, and have the great fortune of introducing you to our speaker. I wanted to give a bit of context for those of you who maybe don't know. In 2020, the In Plain Sight report was released exploring Indigenous racism in the BC healthcare system. And the report found that widespread systemic racism against Indigenous peoples exists in BC. And they outlined 24 recommendations for systemic action. And at least 3 of those recommendations speak directly to the education of health leaders. So within the MA Leadership Health specialization, we explored how can we take action. And one such action was the integration of the In Plain Sight report within the program. And last year, we had the incredible opportunity to learn with Harmony, the executive director of the In Plain Sight report, to learn more about the findings and the implications for health leaders. So today offers an opportunity to further delve into these learnings, and it is with deep gratitude that I welcome Harmony today. Harmony is from the Tla'amin First Nation ancestry and was raised in Tla'amin territory where most of her family resides. She also operates a consulting business providing strategy and advisory services in Indigenous health, governance, and human rights, as well as teaching on many of these matters. She has served in senior roles with the In Plain Sight Review in BC Healthcare and with the First Nations Health Authority, First Nations Summit, and First Nations Forestry Council. She is the co-author of a number of publications, including books about her grandmother's life history and her community's teachings. She's also the Vice President of Indigenous Wellness and Reconciliation with Providence Healthcare and an adjunct professor with the School of Population and Public Health at UBC. Through my interactions with Harmony, I've also come to know that she is graceful. She tells it like it is. She's funny, and she's also deeply committed to change for both past, current, and future generations, including her beautiful nieces that are shown in these photographs. Harmony, it is a pleasure, and I just want to say thank you so much for joining us today.
Thanks so much for inviting me and for that kind introduction. I've got a bit of allergies and compared with the chest cold, so I'm going to do my utmost to get through this without losing my voice. I see a lot of people I know and people I call friends and heroes of mine in the participant list. So I just want to acknowledge all of you and thanks for taking your time with me today. I had the opportunity, as mentioned, to oversee the team that led the In Plain Sight report under the leadership of Dr. Mary-Ellen Turpel-Lafond, who, you know, I is very much a good friend and mentor of mine. And so I'll do my best to represent us in my words today. So I am going to hopefully share my screen in a way that doesn't make a fool of myself. Hopefully people are seeing the right thing. Elliot's beautiful artwork, wonderful. So it's been 18 months. On May 30th, it'll be 18 months since the release of the In Plain Sight, the main report and the summary report. I appreciate very much this opportunity to keep this report alive, and particularly the experiences of all of the like 9,000 people that engaged with us in the course of the review, many of whom, you know, had to be really courageous to share their experiences with us. So that's kind of part of doing these reviews, is that you then take on this obligation to keep those words and keep that trust moving towards positive change. So today, what I'm going to try to do in our time together is talk a little bit about the findings and recommendations in a fairly brief way, more from, I would say, a strategic or meta findings level. I'm assuming if you're joining this, you've probably read the report, I'm hoping, sometime over the past 18 months. So I'm going to try to not just summarize the report, but talk a little bit more about like what were the overall findings that we made that might be even more meta in nature, and how does this relate to and have implications for leadership. Overall, I would say that like we found our experience to be one in conducting the review where we did have the opportunity to engage with many leaders with integrity across the system who I think are genuinely committed to make the change that is so necessary, who were welcoming of the process, and I think were honest with us about the challenges that they were facing. That cooperation and that kind of participation by leadership was key to the success of the review, in my view. at the same time, when I step back and I think about like, what are the meta findings of the review? Like some of the things that come to mind to me are, like, we fundamentally found that there's a lack of understanding about Indigenous-specific racism and what it looks like, right? There's this kind of like conversation about racism, but what does it look like was something that I think we tried to fill that in the data that we presented in the report, such as the specific profiling and stereotyping that Indigenous people experience. We found that there's not really a lot of solid understanding about the root causes of that problem. Where does it come from? How are we socialized in that problem? We found that there are lots of individual initiatives happening that are positive and that use similar describing words, but there are no systemic, clearly defined terms with associated systemic solutions using the biggest levers for change that we have in the system. And the tools that we have are not really well understood, and that there was a bit of paralysis around that lack of understanding. So we have a UN Declaration on the Rights of Indigenous Peoples, and we have a Declaration on the Rights of Indigenous Peoples Act here in BC. And there's a lot of information gap about what that actually means for healthcare leadership. And then there was some question about what can we do as human beings in this space, and what can we do as leaders, and what is our kind of personal and professional obligation to address the problem, which can feel overwhelming, right? Based on everything I just said, people are overwhelmed by it. So what can we actually do? So those are the things that I'm going to talk us through today. So I just want to be kind of honest about what I'm going to be talking about and just have people be prepared for that. So, you know, for the many Indigenous folks that I see on the line today, like, obviously I'm here to talk about these hard things in order to make positive change. It's not like fun necessarily for any of us. And so I recognize and acknowledge the kind of strength and courage and resilience that takes. And I want to give you fair warning that this may trigger unpleasant feelings. If you need to leave, then by all means do so. There's resources available like the Quiz Crisis Line and other support that's readily available to you. And for non-Indigenous folks, I would just say that this is a continuous process of learning and unlearning, and creates discomfort. So often I see feelings of shame, I see feelings of guilt, I see sadness, I see resistance sometimes, like challenging. Those are all, you know, normal things. I would just invite you to sit with that discomfort, recognize that as part of the process, and use it to fuel your responsibility for making a positive contribution. This is just going to be a really quick refresher. I'm not going to take a ton of time on this. As it was described in the introduction, the review began 2 years ago, essentially. And we released our initial reports in the fall, in November 2020, and then a data report in February 2021. The methodology for the review examined a number of lines of evidence. All of the tiny dots on the left-hand part of the slide are the kind of direct touch points that we had with individuals through either one of our 2 surveys, our direct email and telephone number that we had set up, and the key informant interviews that we conducted. And then on the right-hand side, and this was, I think, an example of the leadership that was shown in the course of the review, is that the minister did provide delegation to us under the Ministry of Health Act to conduct the data matching that we needed to examine health care outcomes in particular, and health system utilization, or essentially how does the system perform for Indigenous peoples in comparison with non-Indigenous peoples. And we also were able to partner with Indigenous data governance processes, such as that are overseen by the FNHA and the Ministry of Health, as well as the Métis Nation BC, to follow those protocols for the data matching and data pulls that we did. So on the right, those are all of the data sources that we pulled. We did a number of data matches, like I said, on system performance and outcomes, as well as things like patient reported experience surveys, and complaints files. So those were all of the kind of data points that we pulled into the review. So like I said, there was like a number of what I would call meta findings, right? So we in the review, we had 11 findings, and they're very specific findings. Like kind of more broadly, what we found was a lack of understanding about Indigenous-specific racism and what it looks like. What are the specific stereotypes that people are faced with? We found that there's not a solid understanding of the root causes of that problem. Where does it come from? Nor what it does to people. What are the outcomes of that problem? So that's what this infographic essentially does, is try to create some knowledge equity around those issues. So this is a representation of essentially the main findings of the review. So when we look at the kind of 11 o'clock part of the infographic, like our people come from like time immemorial knowledge about about what keeps us well, about how to live in a good way, how to keep ourselves healthy and well, and to thrive. And the societies here in BC had a proliferation of cultural expression and knowledge that demonstrates the degree of health that people had. Like the sheer number of languages that we have in BC, to me, is an indicator of how healthy our people were, that we had such sophisticated societies and this number of languages and cultural expression. That was supported by medical systems, by our own doctors, by our own knowledge systems. And that kept our people well for millennia. And colonialism, which is a system of subjugation designed to disempower people, to remove people from their lands and resources, and politically control them, was imposed on First Nations people here in what's now BC. And in order to do those things, right, like to foist these systems of oppression on people, you need to kind of come up with a narrative about the inferiority of those people in order to justify that politically, right? So creating a set of policies around residential schools hinges on a stereotype of Indigenous people being bad parents. Creating the Indian Act, a pass system, hinges on a stereotype that Indigenous people are contagious, can't take care of themselves, less capable. Creating segregated hospitals comes from these stereotypes that, again, were kind of infectious, that we are less than and require substandard care. So these systems of oppression and these policies and processes of colonialism rest on a set of beliefs that are essentially about the inferiority of Indigenous people. And then that's how those were able to be justified and maintained, and why we, and our ancestors, accepted those, not my ancestors, but other people's ancestors, accepted those as like normal things and normal ways to treat Indigenous people. And all of our institutions are built in that foundation. They are rooted in that foundation of our colonial past. And that gives expression in inequitable laws and inequitable policies that treat Indigenous peoples differently and produce inequity. It's also produced by the fact that many of those stereotypes and beliefs about Indigenous peoples and their inferiority are still very much a part of society here. And so we are still socialized in this set of beliefs in maybe less overt ways, but they are certainly there. So when we examined common stereotypes about Indigenous peoples in the healthcare system today, you can see kind of around the 2 o'clock, those are the top stereotypes that we pulled from all of the lines of evidence that I briefly recapped for you. So that Indigenous peoples are essentially less worthy, drinkers, alcoholics, and drug seeking, bad parents, frequent flyers or high users of the system, non-compliant and less capable, get stuff for free, and then stacked on top of this is a whole set of misogynist beliefs about Indigenous women, that we are more sexually available, that we have different pain tolerance and different pain thresholds, essentially more disposable as human beings. And so those stereotypes you can see have many of those same roots as what I talked about, right? That these, for example, the stereotype of bad parenting is something that's very, very long-standing. And that helps shape like discriminatory treatment, because there's a profile that someone has in their mind about an Indigenous person. And we all have bias, right? Bias is a process of the brain. And we all create these mental shortcuts that help us get through life because we can't handle every single thing that's coming at us with the same degree of complexity. But when we do that to other human beings, it produces differential and inequitable patterns at an individual level and at a population level. So what we see is a common set of discriminatory treatment that happens to Indigenous peoples. Abusive interactions for sure. Denial of service and ignoring and shunning. So if you think someone is less capable, you're probably taking and investing less time in conversation with that patient. Inappropriate pain management. If you think someone is drug seeking, then you have a different prescribing pattern around their pain treatment. Medical mistakes, right? So if you think someone, or you kind of make an assumption that someone is intoxicated, then you're missing a diagnosis of a stroke or a diabetic episode. And then on top of this, there's all this disdain for cultural healing, right? That your healing doesn't belong here. This is real science and your science is not real science. Meanwhile, as we know, the vast majority of pharmaceuticals come from Indigenous knowledge to begin with. So when we think about there's also a relationship, I would say, between discrimination and poor outcomes directly. So if you think about like a dotted line across that circle, we were also examined a data set that revealed that the very experience of racism and discrimination was directly correlated with self-reported poorer health outcomes. So just the experience, the bad experience, is also negatively affecting people's health and well-being. Additionally, that kind of negative experience is also shaping differential access patterns for Indigenous people. So if it's an unwelcoming environment, if you've been treated poorly, if you're not getting high quality care, like this produces system performance that treats Indigenous people poorly in comparison to others. So we have lower GP and NP attachment. We have avoidance of healthcare on the part of Indigenous peoples. And all of this cumulatively, in addition to the fact that healthcare is like a system that exists within society. And these stereotypes are not just stereotypes that show up in healthcare, right? These are widespread, they're indivisible from society. And so we know that many of these same patterns show up in other sectors and in society as a whole. And so this production of poor outcomes is also taking place in the context of many other systems also underperforming for Indigenous people. And so we end up with inequities in areas like chronic disease rates and progression of chronic disease, infant mortality, life expectancy, the list goes on. And usually those things are reported out of context of this root cause, right? We just report, well, there's a disparity. And all that reporting does without this context is reinforce the very profile that people have in their minds about Indigenous people. So, oh, higher infant mortality. Well, no wonder they're bad parents anyway. What do you expect? So illuminating this cycle was critical for us to be able to kind of level set with the health system about what is Indigenous-specific racism exactly? What does it look like? What is the specific profiling and stereotyping? And what are the root causes of that? And how does that help explain then what the root causes we should be attacking if we actually care about these injustices and these inequities that Indigenous peoples face? So how do we disrupt that cycle? So we think it's through the adoption of new mindsets, tools, approaches. We found for sure there's like a lot of these words are used and they're used really broadly and widely. And that's great, but they're not really clearly defined. So when we're kind of like pushing on that, like, okay, so what do we mean then by cultural humility? What is that term? What does it look like? What are you doing about it? What we're finding is that there's actually kind of like a high degree of like sloganizing, or maybe like these are like a really nice motto people are using, right? People use terms like cultural safety and humility. Or I would maybe even venture to say we're using terms like truth and reconciliation. And I wonder if people are being really thoughtful about what those words actually mean and what it looks like to then take action in pursuit of those desired mindsets. So we also have a faulty definition of certain terms, right? That kind of feed our inability to talk about things, right? So we kind of tense up when we hear certain words. It used to be that we couldn't use the word racism. I think that's still, I'm definitely still in conversations where that's challenging for people to talk, like they think I'm name calling them. And what I'm trying to do is describe a social process. White supremacy is another term that I think there's not a really great understanding of that describing a social process and a social problem, as opposed to, I think, what images people like leap to mind when I use terms like that. So all of this is getting in the way. This like lack of shared language, shared meaning, shared definition is getting in the way of us making progress. So this was why we included a glossary of terms in the review, and why I'm going to take just like a few minutes to talk about what we think these desired mindsets actually mean. So cultural humility is like an inward facing practice. It's a process of self-reflection, self-interrogation, of learning and unlearning, probing one's biases, being honest with oneself about what stereotypes, what profiles are you kind of placing on others? Where do those come from? How am I conditioned in that? How is that likely to show up in my behavior? How can I positively disrupt that? What commitments am I willing to make? What am I not willing to do and why? What privilege might I be willing to give up? What discomfort might I be willing to experience in order to achieve greater equity for others? That's essentially what cultural humility to me is about. It's about understanding also that in doing that self-interrogation, that's knowing oneself, but you can never really understand someone else's experience. And so putting yourself like on the same level as someone else and not above, and assume that you know what they mean and assume that you know what they need. And this is important in healthcare when we're like making these rapid decisions about diagnosis and about, you know, what people are coming in, what problem they're coming in for a consult for. So cultural humility, inward facing, kind of reflective practice. And anti-racism is the other mindset that we talked about in the review quite a bit. And it's more of an active practice. And this is why I think it goes nicely hand in hand with cultural humility, which is the inward facing one. This anti-racism makes us feel like we can do something, right? Like we have agency, we can contribute to this problem. So we tend to think, so this is the other kind of problem, is that we tend to define like racism and then say like not racist, right? Well, I'm not racist. Or I don't see color. And like, that's not real. That's not a real thing. If we say we're not racist, all we're doing is letting ourselves off the hook from doing this work. It means we're making a choice to be complicit bystanders. And what we're saying is that you can make a choice between the opposite of racist is anti-racist, right? I'm either complicit in the system or I'm taking an active stance to combat racism in all of its forms. I'm going to speak up when I see it. I'm going to review documents from the lens of anti-racism and achieving equity. I'm going to make commitments, and we'll talk a little bit more about that later, specific things we can do. So the mindsets we're kind of trying to engender in people is like this inward facing cultural humility, this active commitment to anti-racism. So we've talked about the problem, we've talked about the mindsets and approaches. What for? What is all this for? Well, it's to support Indigenous people to live their human rights. We use the United Nations Declaration on the Rights of Indigenous Peoples as the frame for recommendations for the report. Particularly that given in BC, we have a unique, or at the time we had a unique set of legislative tools and obligations. So the UN Declaration has been framed as the framework for reconciliation. That is also what our legislation here in BC says. It's 46 standards for the survival, dignity, and well-being of Indigenous peoples worldwide. Like, what are human rights? Like, they are inherent to who we are, and they're indivisible from us as human beings, and they're all interdependent and in relationship with each other. So in BC, we do have the Declaration on the Rights of Indigenous Peoples Act that creates a set of obligations on the province. And so many of the leaders that we spoke to in the course of the review were kind of roughly aware of like the fact that there is this piece of legislation, very unclear about what it meant for them in their roles and for their organizations, and very unclear about like how to take the UN Declaration on the Rights of Indigenous Peoples and use that as a frame to support their organizations to be a rights affirming organization for Indigenous people. So our recommendations really intended to give the expression to this, and also to very clearly articulate like what are Indigenous human rights to health. So like and what is the relationship with cultural safety, which is also the term that we hear a lot, right? So our view is essentially that cultural safety is Indigenous human rights. It's an identity affirming experience. It's saying that you can go somewhere and feel like you can be Indigenous somewhere, and that your human rights as an Indigenous person will be upheld. That includes the right to self-determination. That's both a collective right of our governing bodies to be involved in governance and decision-making, and it's individual right that I have the right to make decisions for myself and my own body. It means we have the right to traditional medicine, Indigenous health practices, and to our science and our scientific ways and beliefs, that we can access care without discrimination, and that we have the right to the highest attainable standard of health, which in the report we framed as substantive equality. So in summary, what we're trying to do here is make this shift, right? So we're like, where we are is we have this kind of mindset that we've all been socialized in different ways, and that is our reality of the legacy we've all inherited, which is a legacy of colonialism, a legacy of indignity against Indigenous people, of kind of like essentially white privilege and privilege of different forms. And all of this comes at the expense to Indigenous peoples. Those approaches and mindsets support a set of beliefs and behaviors, the problems that I talked about: racism, profiling of Indigenous peoples, discrimination, prejudice, and then this like kind of inability to talk about this problem because we don't have the stamina, we're not used to it, we don't like these words, we think they mean something they don't. And the outcomes of that are just, like I said, indignity, poorer outcomes, inequity, racism, and discrimination. And what we want to do is make this shift, right? So we want to have Indigenous human rights as the frame and the overall approach we're taking. We advance those human rights through the practice and exercise of cultural humility and anti-racism in order to achieve substantive equality, cultural safety, and what we call reconciliation, which is like can only really, it's not friendship, right? It's like taking active steps to recompense, repair, restore, reconstruct. So based on that, we developed 24 recommendations for the review. They were in kind of three buckets, all framed from the UN Declaration. So we had 10 systemic recommendations focused on things like, how do we use the deepest levers we have in the health system? How are we using legislation? How are we using policy? How are we using our mandating process? How are we using data and measurement to support accountability? We have a set of recommendations on behaviors, like specific things where we think we need a shift in this part of the system here. So things like, how do we have more Indigenous leadership within the healthcare system? We need specific kind of focus on efforts such as like in mental health and wellness and for Indigenous women, which data showed was of significant concern. And then we had a set of educational recommendations, which we framed under the heading of beliefs. So what can people do about all of this? Like, so there's like basic human stuff, like there's human being stuff we can all do. And like, I'm kind of the philosophical belief that everybody's a leader in their own way. And so these are ways that every human can just be a leader in this work. The main thing is self-education. Like there's lots of like smart people have written all sorts of really amazing things and like make podcasts available and like have blogs and all of this content that's out there. So I think self-education and having then those discussions in your circles of influence about what you're learning. The self-interrogation, I riffed off a whole pile of questions earlier, so I won't repeat those. Like put your dollar towards Indigenous businesses. Like there are Indigenous suppliers for everything. Like that's really basic stuff we can do. We can participate in change efforts. We can speak up. We can make space for Indigenous people to speak. We can be a good colleague to Indigenous people. And I'm going to talk quite a bit about that. And we can also just be hopeful. So these are all things that we can do. There's also things we shouldn't do. So we shouldn't, this is a really basic one. It's just a pet peeve, so I put it at the top of my list. Like, don't use the possessive when referring to First Nations people or Indigenous people. That's like one thing. Don't appropriate and take stuff from Indigenous people for your own benefit. Don't use Indigenous peoples as props, right? Like, do the underlying work in policy and in practice. Don't just ask Indigenous people to like do all of the work like land acknowledgements and openings to meetings. Don't make it about you, is an easy thing not to do. Optical allyship or virtual signaling, like don't just do things in order to, again, center oneself and not be championing deeper change at policy or practice level. You have to take risk in this work. And so saviorism, optical allyship, tokenism, all of those are easy things that involve no risk. And I think that this work does require risk taking. And that's what leadership is calculated risk and doing risk for the right thing. And then cultural loading, which is essentially, you know, putting additional demands on top of Indigenous people's workload that they may not be prepared to do, not wanting to do. It's typically unrecognized labor, emotional, intellectual labor that's not compensated, that kind of tends to be ambushed on Indigenous people when they're not ready or haven't been prepared. And there's a lot of pressure that comes along with that, right? Like, oh, we have to be experts in all things Indigenous and to have expertise in educating others when we too are very diverse and different from one another and have different gifts to bring. So not all Indigenous peoples choose to do this kind of work. And so I think being aware of that and cognizant and safe about that is important. And then like, what can you do? So we heard over and over and over and over in all of the surveys and everything we did in the review that people are looking to their leaders to set the tone. So leadership is critical to confronting this problem. Some of the things I think about in that space then, like as someone who's been in leadership position, like we're really used to like being in charge, having mastery, knowing what we're doing. We're really used to not admitting when we make a mistake, and we're really used to not admitting when we don't know the answer. But we need to be comfortable with that. Being comfortable learning and leading at the same time can be uncomfortable. We'll make mistakes and people will notice because everyone's watching you because you're the leader. This is modeling the cultural humility behavior that we actually are encouraging as a mindset. So Louise, who's with the College of Nurses and Midwives, is really good at talking about her discomfort in learning while leading. And I've learned a lot from her on this. And I think it's a really critical point to just acknowledge and like be comfortable and take the risk. Set the tone. So leaders have to set the tone. They have to use their privilege of their role to speak up on this issue and to create the space and the expectation that everybody else speaks up to. We need to embed Indigenous human rights and cultural safety in everything. This isn't just like we're going to celebrate a day a year, or we're going to acknowledge and commemorate a day a year. This is about tying this into our laws, policies, plans, physical spaces, decision-making tables, investments. It's everywhere. And we have to be prepared to then change. And part of that is bringing Indigenous people on contract or in staff roles, in senior roles. They'll be your conscience and they'll be challenging, and you have to be prepared. We have to be prepared as leaders to welcome being challenged and to welcome having someone tell us that the way we do things isn't working. They're also being brought in because of who they are, right? Their identity is part of why they're being invited into the role. Therefore, like, they need to be supported to nourish that identity as part of their job. So that means that they can't be treated just like everyone else, that this might challenge some of our HR processes, our typical leave processes, all of these things that we try to standardize so much. And really why Indigenous people choose not to work, many choose not to work in these organizations or struggle in those organizations. And it's because they're not structured to support us to give expression to our identity, which is the very reason why we're being brought into those roles in the first place. So, so I think people need to grapple with that one. So with that, I think that's kind of all I really wanted to pitch today. I hope people are still reading the report and keeping it alive, and that some of my commentary today was useful for everyone. Thank you.
Well, thank you so much, Harmony. I'd like to invite, perhaps we can go back into gallery view, and if people want to use the reaction tab now to express their love, there's lots of hearts and applause coming up for you, Harmony. I hope you can see that. Lots of messages saying thank you coming through in the chat as well. So we have been keeping track of a few of the comments that have come through while you were speaking, and at this time I'd also like to remind people of the values expressed at the outset. Of course, humility. You reinforced this one quite a lot, Harmony. Cultural humility in particular, respect, integrity, generosity, courage, empathy, and fortitude as we move into this question period and this opportunity for dialogue with one another. People are continuing to definitely express their gratitude to you, Harmony, in the chat, if you can see that coming up as well. But in the meantime, let me just share a couple of the comments that came through for you. We had a few people connecting with you personally, reminding you of how you worked together or the different ways that they have consulted with or worked with you in the past. So a shout out to all of those people who put some personal connections in there. Thank you so much. There were a few people who shared their personal experiences of healthcare. For example, Targol Salehi said, I'm a social worker in community healthcare setting and had an Indigenous person I work with tell me that they would rather die than go to the hospital. Fortunately, because I work in community, I was able to have a nurse do some intervention. And likewise, Rhonda Bird said, my 81-year-old mom went to emergency because she had a diabetic reaction and left her feeling very unwell. They made her wait in the waiting area for 5 hours, then accused her of coming to emergency to be fed a sandwich and juice. So those were just a couple of personal experiences shared. I wonder if you wanted to respond, as you were sharing examples of how racism plays out in healthcare.
Yeah, like unfortunately, we dealt with hundreds of those in the review, and it's like why we're doing this work. And I do worry that like what's the outlet for that now? Like the report itself doesn't necessarily change anything, right? Systemically. So hopefully it creates awareness and it creates the right conversation. But we were extremely concerned that, we'd created this venue or this forum for people to, call and like email us, and that we would be following up. And I know that Mary Ellen in particular, she's like a highly public figure. Everyone knows her. She's got a reputation for like relentlessly speaking truth and pursuing justice. And she still gets these complaints to her. So I think I'm really still hopeful that some of the work around creating a representative and advocate position, as we recommended, will happen. Like to me, there's still a strong need. And that doing this work of rebuilding trust is really difficult when we still have these experiences happening, and then we tell each other about them, and then it's like, yeah, we're all avoiding it, so I just still see that there's quite a bit of need for the structure that we had in place for the review, for people to just have someone that they trust to talk to, and that will see some of these issues through and help broker some of the follow-up work.
Thank you, Harmony. There's a couple of questions just about, the report offers some recommendations, and at the highest level of decision making, how are these actually being implemented? What are you seeing 18 months on?
Well, I would say that Mary Ellen did release a one-year little summary, and I think I see some folks from the ministry here, and I know that that team has been working hard. Dawn Thomas was the ADM for the last little bit. She's going back to Island Health, but has done like a really amazing job in a very complex environment to try to advance this, not only in terms of like doing the work itself, but how to do the work. And I think that's been really challenging to move forward kind of at the same time. Some of what I've seen so far that I'm encouraged by is the focus on Indigenous people in senior positions, not just in the health authorities, but I see other people on the line who are in senior roles, like at post-secondary institutions and other places. And so like that is important to create that space. And that's been something that happened quite quickly. I know that my colleagues across the health authorities, myself at Providence, we have plans and strategies, and we're, expanding services, and there's work being done. I again am worried. I'm like, is this systemic, or is this like we're each doing our own thing again, which was the very finding of the review, is everybody's doing their own thing. I'm encouraged by things like the Antiracism Data Act. I think it's going to be challenging in practice, but I think it's the right thing. If we respect Indigenous data sovereignty and we can illuminate these disparities and properly attribute root cause, then I have a lot of hope for those like systemic changes like that. So there's signs of progress. Like nothing ever moves fast enough for me. Everyone who works with me knows I'm like a pace person. So I'm like, we got this whole review done in like 4 months, right? So like we like to move fast, but I know that systemic change takes time.
Great, thank you so much for that, Cheryl, the bundling of some questions, and Harmony for your response. I'll just jump in with a couple more questions here. There's one from Lori, recognizing justified mistrust. I wonder how this might support system accountability and potentially more accurate data on inequity. Lori is saying there's a feeling like the data available might only represent the tip of the iceberg. What do you say in response to that?
Yeah, I totally agree. I think, and yeah, this ties somewhat to the anti-racism data point I was making, which is like there's an opportunity now to both, I think, improve the quality of the data we have, as well as treat it the right way in accordance with Indigenous human rights to own the data about their own people. So I just ran a little project in my own context at Providence to get a better sense of whether self-identification of Indigenous peoples when they present to our facilities, like how much can I rely on that? And yeah, not that much. So like there's work to do. I think there's lots of reasons for that. People are not equipped to ask the question in a safe way. People don't feel like safe answering the question and understand why they would do that. Our systems don't capture that data in a very effective way. So like there's lots of work to do to kind of further solidify, but I'm hoping that, you know, the effort that we did in this report at least, you know, takes a step forward in terms of identification of some of the measures and indicators that might be relevant moving forward, as well as the need for like multi lines of evidence to be coming in order to kind of understand more fulsomely the scope of the problem and potential solutions.
Thank you so much. Cheryl, do you want to jump in next with the next question?
Yeah, sure. Thanks for that, Harmony. And so many questions coming in, just trying to pick a few. So if we don't get to your question, I do apologize. There are some questions around really, as nurses and employees, how do we interact with patients to ensure that they feel more comfortable and safe? I'm wondering if you have any insights or reflections on that. As someone working with Indigenous people, how do I create a safe environment for them?
I think part of it is taking the time, and I know that this is like easier said than done in healthcare. I work in it and I understand it. So part of it is that it's like building an authentic kind of relationship. I do think that these relationships are improved and smoothed when we can rely on the Indigenous team in facilities and organizations. Like having that service, I think is helpful for all involved in the circle of care, and can create some ease and trust with the patient. Trauma-informed approaches and training and like practical trauma-informed approaches and training are helpful, not just theoretical stuff, but like what does this actually, you know, look like? Like when we are standing there with our checklist at the side of the bed and someone's laying in the bed, kind of maybe think about what that might feel like for someone who maybe has been in residential school, to have someone of authority in a uniform kind of barking through a checklist at you. Like there are certain things that I think we can be more conscious about if we're forced to kind of sit our way through like training. I also think organizations need to provide for more shoulder-to-shoulder coaching and intervention style training, in addition to the other types of training that people tend to customarily take. Those are all important things, but we need more aspects that are actually related to how people spend their days, how they discharge the obligations of their job on the sites and with the people that they actually work with. I also think that like when we released this report, it was like a number of months after that, there was a lot of the news coverage around the like kind of recovery of our ancestors and relatives from the grounds of residential schools. And I don't know why I was surprised, but I was surprised at the surprise that other people had about that. And I'm like, we've studied this, we've talked about it. So that was just another reminder to me about like, we are all in this. Like I work in this like 24 hours a day, and there's like 95% of the rest of the people don't. And they have very limited kind of exposure to this. So like we have to have multiple rolling solutions for public education and awareness at all levels of the system. And we have to invest in it. Like, it can't just be like, we're going to start teaching kids now, and then we're going to ignore everybody else and just wait for like these kids to grow up. Like this is doing damage and harm to people today. Like, it's an obligation that we address this, I think, at point of care, in training and education, in the public awareness, and in schools. And that this is done in, if we do this well, like, it'll make things better for everyone. Indigenous cultural safety isn't just for Indigenous people, it makes things safer for everyone.
Thank you, Harmony, and seeing lots of comments and in the chat, just acknowledging all the points and in lots of agreement there. So thank you.
Yeah, and let's perhaps we can go to one more question from Cheryl and one more from me, and then we'll start to wrap things up here, Harmony. So as Cheryl said, we can't quite get to the specifics of all the questions that are coming in, but just generally speaking, there's kind of a set of questions around hope. Is there hope that we actually can begin to assess racism in our healthcare system? Is there hope for major changes to occur so that Indigenous people could feel comfortable and feel culturally safe when visiting a hospital? So there's kind of a series around, is there hope for this? And then there's kind of another grouping of questions that's about, what are the actual strategies, if you have them, to recommend, Harmony? People are sincere in their desire to recruit Indigenous staff, for example, but finding that there are more barriers to recruitment and challenges with recruitment. And likewise, sincere in their desire to teach trauma-informed care and relational practices, but also trying to balance, not feeding into the stereotypes that you mentioned at the beginning of the call. So how to address sincere, legitimate health outcomes and concerns while not further driving the stereotypes. So those kind of like how to address the challenges, and then what are your words around hope and the driving factors behind hope that probably inspired you to write this report.
Yeah, there's a lot there. Yes, I have hope. Like, things change. Like, things have changed in my career a lot. Things have changed in my lifetime a lot. So but they don't change because people just wake up one day and decide to do the right thing. Like, they change because like people are relentless in like pushing for the change, and we then like kind of need to pull that through kind of on a continuous basis. So so I think that things have shifted significantly in my career, and I've seen positive change over the last, year or so. Like, never fast enough. Like, that's just how I am, like, as a human. I would say that there's a need for that. Change is accelerated when we have like a dedicated focus on change leadership. When we think about ourselves as a system as a whole, and that we recognize that system is made up of many moving parts, that we can't control every variable and plan for every variable, but we have to pull through the core of what it is we're trying to achieve at multiple levels, top down, bottom up. And if we enable the bottom up stuff to occur and be really clear about like expectations, like things like you need to speak up, and we create those organizational environments for individual people to have space for accountability where they're not afraid of retribution, like, then we create and generate bottom-up approaches. And we can create top-down strategies, or like, I guess, like pulling our systemic levers through making change. Like if we take that example of people who, like, we want to bring in more Indigenous people, and yet more than half of the Indigenous people who responded to our survey said that they're experiencing racism at work. Like, yeah, me too. So like, how is that we create that right environment. Like, we can't have more Indigenous healthcare professionals if more than half of us are experiencing harm at work. So what we need to do is give space for people to speak up, not just us, but our colleagues, to be like, hey, like, what did you mean by that comment? Or like, hey, that was strange. Where are you getting that feedback from? Or, hey, maybe we should make some space for so-and-so to speak. We haven't made space for them to speak at all on this issue, right? We need to create that environment where that's the expectation, and the leadership has a role in creating that culture. We also need things like collective agreements revised in order to provide for things like Indigenous people to be able to exercise their identity, and for the organization to actually see that their identity adds value to the organization. Means that there needs to be ways in which collective agreements create space for that, for example, right? Like, we have different ceremonial obligations. We might have different family obligations. And like, if we treat identity as a value, then that's a good thing. And then that's not just feeding into the stereotype of free stuff. It's about recognizing that this is a valued identity to our organization, therefore we're investing in it. And kind of on that note of like feeding into the stereotyping and the kind of point that was made about trauma-informed training. Yeah, I agree. I struggle with some of the terminology we use. You can tell I'm like a words person and like kind of unpack words and like push on words. And like, really, I think that some of this it's not about our trauma as much as it is about like this unsafe system that keeps exposing us to harm. And that it's the system itself that needs training on how to be better in order to provide for our safety. It's not our trauma that's getting like it doesn't happen on its own. It's constantly reinforced by living in a system that's not safe for us. So it's like proper attribution of the problem, I think, is really important. And I think that that's the right context to frame some of that education in, as opposed to being like, let's pathologize this group of people as being like disorganized and unwell. Like, no, like, let's recognize that our system has a problem, and this is training to help us fix the flaw that we have in our performance.
Thank you so much. Well, what a powerful note to go out on. I'd like to express my sincere gratitude to you, Harmony, on behalf of the School of Leadership Studies, and especially the Masters of Arts in Health Leadership, and everyone out there listening and watching and asking questions and engaging. You have offered some incredibly powerful words today that, as you say, helps to keep this report alive, helps to keep it top of mind, and helps us, reminds me anyways, that I am responsible for and accountable to the findings of this report. Thank you ever so much. I invite people to applaud or give some love to you in the chat. And I'll just invite my colleague Selena to share these final couple slides here as we round off the day. And then last word to you in a moment, Harmony. So this is the first. Thank you, Harmony, for launching us off in this first of 3 webinars. So we have another one coming up next week already, Relational Systems Thinking with Melanie Goodchild, another fantastic speaker. Selena has put the link to register for this and the next one coming up as well in the chat there. So please feel free to join us. Again, if you'd like to register, but you can't attend live, we will be sharing the recording. And then a little bit later in June, just before National Indigenous Peoples Day, Harley Eagle, just more on what you have shared here, Harmony, a trauma-informed approach to cultural safety with Harley Eagle. That one's coming up on June 20th. So please register for those webinars if you're interested. And again, thanks to Harmony for starting us off. Next slide, please, Selena, as we just wrap things up here. Very, very briefly, I'll mention that the School of Leadership Studies has a number of different programs. So we talked to you today about the Masters of Arts in Health leadership with the health specialization, specifically because the recommendations of this report are relevant to the health leaders who join that program. But in fact, as you yourself said, Harmony, these teachings are important across all sectors, and health intersects with all sectors and all systems. These foundational assumptions, prejudices are alive and well, regrettably, in other systems as well. So there are many, many different ways that you can explore this further, if you wish, at Royal Roads University with us, through master's degrees in leadership, an executive leadership specialization, some graduate certificates, values-based leadership graduate certificate, and a whole suite of global leadership programs, master's degrees, diplomas, in-person, online, blended, lots of different options for you here. And we are, as you say, Harmony, not fast enough, but we are endeavoring to integrate these teachings into all of our programs in the School of Leadership Studies. Final slide, please. There we go. If you'd like to get in touch with us, here's some contact information. learn.more@royalroads.ca, or here in the School of Leadership Studies, leadership.admin@royalroads.ca. I think I saw maybe 2 or 3 people on our registration list from outside of Canada, so there's some international admissions contact information there too. So thank you, Selena. Let's just show the social posts at the end. And Harmony, over to you for any final words you'd like to share in closing.
I think everyone's heard enough for me, but I would just say thank you for like creating the platform for this conversation. Thanks to everyone for joining and keeping the report alive. There's like the worst nightmare when you write these kinds of things is that it'll just like sit on the shelf and no one will use it. So yeah, thanks for joining. And there's no word for goodbye in Ayajitham. So I would just say Emahuiga, which means go well.
Wonderful. Thank you so much. So we'll stop the recording there, and that will be a wrap for us today. Thanks everyone for joining us. There's a whole waterfall of wonderful thank yous, some sharing of resources, a lot of gratitude coming your way in this moment, Harmony. I hope you can see it in the chat.